Hello, my name is Tiffanie Leeman. I'm a medical student at the Medical College of Georgia. I'm here today to talk about chronic fatigue syndrome, or CFS. Chronic fatigue syndrome is a debilitating disease that causes severe fatigue. This fatigue gets worse with mental or physical exertion and does not improve with rest. According to the CDC, up to 2.5 million Americans suffer from chronic fatigue syndrome, but 90% of these people are not diagnosed. This is likely due to a lack of awareness in the public and medical community alike. The cause of CFS is currently unknown, but this does not mean that the symptoms are any less real. In addition to persistent fatigue, people with CFS may have trouble with concentration, sleep, pain, or dizziness. These symptoms may develop after an illness such as the flu, mono, or COVID-19, or they may develop gradually over time. People with CFS may have difficulty keeping a job, going to school, or doing their usual activities. It may even be hard to get out of bed. Symptoms must persist for at least 6 months to be diagnosed with CFS. Your doctor should also rule out any other possible conditions that may be causing your symptoms. There is no cure for CFS. Treatment is tailored to a patient's specific symptoms, and what works for one person may not work for another. This may include managing activity levels, medications, good sleep habits, diet changes, and cognitive behavioral therapy. However, it is important to speak to your doctor before starting any treatment for CFS, since some treatments are unproven, costly, and could have serious side effects. People with chronic fatigue syndrome often feel frustrated by our lack of understanding and proven treatments for the disease. They may be dismissed by others, and they may feel like they are making up their symptoms. Thus, it is important to know that chronic fatigue syndrome is recognized by medical professionals as a real disease. It is important to spread awareness of the disease to fund research for more effective treatments. If you or a loved one is having symptoms of chronic fatigue syndrome, talk to your doctor or trusted healthcare provider, and know that you are not alone.